they think a lot and they have to invest about the security. But there is a good say, if you think that compliance is expensive, try non-compliance. And similarly happened with some of the recent companies, those who have faced the HIPAA penalties. Like WellPoint, they have paid approximately 1.7 million for HIPAA violation. Similarly, there was a company, Blue Cross, who has paid $18.5 million because they have not invested enough time and money for the compliance achievement. So before we move and discuss HIPAA risk analysis in detail, let's take some basic details of the HIPAA. The HIPAA, the Health Insurance Portability and Accountability Act, has been divided into 5 titles, or we can say 5 parts. This title 2 covers majorly security rule and privacy rule, that comes under the category of administrative simplification. Some of the basic terminology so that when we talk, we can relate it in a similar scenarios. We may be using a term that is called CE. When we say CE, it is a covered entity. There is a term called as a BA, that is business associate. Next term is BA8, that is business associate agreement. Another abbreviation is NPP, that is notice of privacy practices. So these are the some common terminologies that we may be using throughout the webinar. Then the next point, whom HIPAA is applicable. I mean, when it comes to some compliance standard, we have to understand to whom this particular compliance is applicable. So this compliance is applicable on 4 categories. These 4 categories are, first one is payer, your insurance or health plan organization. Your providers, health care provider, hospital or your doctor clinic. Next is clearing house, who is clearing and settling the actual payment and sitting between the payers and providers. The next category is business associates. So the first 3 categories comes under the CE, covered entities, and the last one is a business associate. When we say business associate, it may be anyone who is performing the function on behalf of covered entity or CE, and they have access to protected health information, that is called as a PHI. Then security and privacy rule. What these rules are? Some of our friends probably they are facing some challenge in, there may be some network connectivity. I hope that will be fixed soon. Okay, so the next category is security and privacy rule. The administrative simplification has 2 rules, security and privacy, where it is applicable and what is difference. Security rule is applicable for any PHI that is transmitted, accessed, processed in the electronic form. Kindly remember, the security rule is applicable for protected health information that is in electronic format. The next requirement is, we have to understand the next term, that is privacy rule. Privacy rule is applicable for PHI, that is protected health information, in any format, either it's in electronic format or written format or oral. So security rules covers your PHI, confidentiality, integrity and availability, that is available in electronic format, while your privacy rule covers the confidentiality part of your PHI in any format, not necessarily in the electronic format. Then we have one term that is called as a required and addressable controls. OCR, that is your Office of Civil Rights, have defined some audit controls. There are 169 audit controls where they have given required and addressable control. What these controls are? When it says required control, you don't have a choice to pick up to implement or not to implement the control. You have to implement this particular control. For example, if there is a control like assigning and documenting the individual's responsibility, it's a required control. It is clearly written that you have to implement this particular control. While it comes to a control like developing and approving training strategy and plan, it is an addressable control. The entity can decide based on the associated risk and environment that they want to go ahead with this particular control, or they can not implement this particular control, but they have to give a reasonable justification for not implementing this kind of control. Then there was a havoc related to HITECH Act and Omnibus Rule, how it's impacting the HIPAA. So we have to clearly understand that these two they have a major impact on the HIPAA. Earlier, the business associate, their liabilities were very limited, and after these two rules and act, they now business associates also, they have to protect all the information similar to CE. So they are similar to CE now, and they'll be liable for all the audits and penalties. Similarly, if your business associate realize that this particular compliance is not being met by their associated CE, they can report it to HHS, your Human and Rights Department, or Human and Health Rights Department of the US. So now they can report these issues directly to HHS. And definitely these HITECH and Omnibus Rule has given a more impact on the penalties and civil liabilities on the CE and VAs. How the HIPAA risk analysis is a requirement, or how it is related to HIPAA. So it's clearly mentioned in the HIPAA requirements 164.308 and 306 that there has to be a risk analysis procedure in place so that you can implement safeguard that comply and carry out the standard implement in a right way. So it's a requirement from the HIPAA standard itself that you have to perform the risk analysis. These are some of the common definitions related to risk analysis and risk related words. So first term is risk analysis. When we say risk analysis, it covers the first step. It talks about the asset identification, the threat identification, corresponding vulnerability calculation, and with the aggregation of these three values, the overall risk has to be calculated. Well, when we say risk assessment, this is more aggressive, and the next step of the risk analysis, I should say, it also involves the existing security and controls that are in place. We have to evaluate the effectiveness of the control, and then we have to see whether the risk is reduced or we need to put further control. When it comes to risk management, it involves earlier three steps plus the treatment of the risk identified. So whatever risk you have identified, you cannot sit with those risks. You have to close those risks, and this is covered in the risk management. So if somebody is saying that I'm doing a risk analysis for you, you have to clearly understand they are only going to give you a calculated risk, but they are not going to calculate the effectiveness of the existing control, and they are not going to give you advisory about the controls that can help you to mitigate the risk, particular risk in the environment. So friends, why this particular risk analysis is so critical? Why everybody is talking about the risk analysis with reference to HIPAA compliance? First of all, if you have to optimize the control investment, because your risk may be unlimited, but your budget is very limited. So you have to perform a risk analysis to understand that what need to be protected. If you have 1,000 server, probably the similar level of controls are not required for all those 1,000 servers. Only 5 or 10 or 100 servers may be hosting very critical information for you or maybe very critical for HIPAA perspective. You need only those 100, 10 or 5 servers to be protected. You need not to invest money for all 1,000 servers. Then it helps you to or it will help you to prioritize the risk so that you can define the prioritization in the mitigation process. How it can help, if you know that your web server is running on an unpatched IS version, probably you have to fix that particular server first, and then if a server that is in an internal server zone, you can fix that server later based on the criticality. You have to fix all those, but which one has to be done first? It can be prioritized based on the risk analysis. So if you have a calculated value, you can clearly assign your action points related to that particular risk assigned values. Then it's not only about the compliance. Sometimes you may be compliant, but you may not be secure, because compliance is a baseline. It's just a floor, and you have to perform the risk analysis to understand particular area where the risk is. Because when a compliance standard is designed, it is designed for all industry, all kind of environment. A compliance standard is not defined or designed for particular environment, like if you are running on a Windows or if you are running in a Linux environment, the risk is not going to same, but the standard is going to same. So you have to assess a specific risk that you are having in particular technology in particular environment. So you have to think about security, not just the compliance. Then people say, I have done a risk assessment, I have met the compliance, so I am secure forever. That is a myth. The threat vector is not a static part. The threat vector is very dynamic. It changes every day with change in the environment, technology. So effectiveness of the existing control has to be re-evaluated every time. So risk analysis gives you a platform where you can perform effectiveness measurement for existing control. Then it helps the organization to take the right decision on the right time. You have to understand that which particular investment has to be made in which particular area, whether you have to fix BAPT findings or you have to go for incident management and contingency planning. So you can decide what has to be done at what time. Recently, Ms. Mac Andrew, the Deputy Director of the OCR, she has clearly said that in the next audit that's going to be happening in 2014, the risk assessment is going to be the focus area of the audit, because they have noted that the risk assessment has been proved as a weak spot, and entities are not doing this particular risk assessment in a disparate or the as intended manner. So how we can optimize the cost for compliance? We have to understand that we have a limited budget and we have to meet compliance. We have to ensure security as well. So first of all, you have to understand the environment and applicability. When we say environment and applicability, it simply means that if you are in a BPO environment or in a call center environment, you are running a business for a CE as a business associate, probably the risk that you have will be different from an entity that is hosting a web application for a healthcare environment. So you have to understand the environment and applicability, which particular environment you are going to be compliant in a HIPAA, and what particular requirements are applicable for you, so that you can design or you can architect your HIPAA compliance control in a cost-effective manner. Then risk analysis and risk management. We discussed that risk analysis can help you to prioritize where to invest first and which particular areas has to be invested. Next, very critical point that people generally miss, that when it comes to compliance, they think about protecting everything and they forget the core part of it. HIPAA core is PHI, your protected health information. So while you are designing the controls, do not forget that what you are trying to protect. Whatever controls you are designing, whatever investment you are making, you have to make sure that that investment, that control is going to protect your PHI. So that has to be the focus. The focus should not be blurred. Resource management. When you are evaluating any control, you have to see how much resource is going to be invested for that. If your HIPAA compliance requires that you need to go for a log management or a log review process, you have to evaluate whether you should buy an automated solution or you are going to hire a team of 4 people who are doing the manual log review process for you. So you can evaluate this particular criteria in the resource management. Then addressing technological advancement. Technology doesn't stop or being invented for any particular compliance. It is invented as per requirement and it will never stop for any compliance or for any security reason. So it will have some particular new technology where the risk is not evaluated or not defined as well. So you have to understand those particular technological advancements also. Example is when you have a mobile application, you are going to launch a new mobile application, probably you have to consider the associated risk with that particular technology. So while adopting new technologies, those new risks has to be calculated so that it, I mean, if you have secured everything and you have adopted a new technology, it should not impact negatively in your environment. Then last but not the least point, that compliance is a program, it's not a project. We should not think that once compliant and we should sit and relax. Compliance is an ongoing thing. Once you have achieved the compliance, it's the responsibility of the organization to maintain that compliance. And as an information security auditor, I believe that achieving compliance is very easy, but maintaining compliance is very critical. So once you have achieved the compliance, you have to make sure that you have maintained that particular compliance going through. Now we have a case study. We'll be discussing an organization where they want to go for particular HIPAA compliance. The organization Health Zone Inc. was a IT and BPO services company which provides different services to multiple health hospitals. Health Zone stores and transmits the PHI through an in-house developed public-facing web application which is hosted in a third-party data center, and they are planning to move this into cloud environment. Recently, Health Zone has allowed BYOD policy, that's bring your own devices policy. There is an information security policy developed by a security consultant around 3 years ago. And now Health Zone wants to achieve HIPAA compliance at the earliest. I mean, they have a guideline from the business side that they have to achieve it within as early as possible. So now we have to see that how they have gone for the HIPAA compliance and how they are going to meet this HIPAA compliance requirements. So first of all, they have to assess their environment with respect to HIPAA guidelines. So they have to start the scoping exercise, then they have to perform the risk HIPAA assessment and risk analysis. So if they have to perform some gap analysis, what will be the next step? They have to perform this particular assessment based on the 169 audit protocols given by OCR. So this covers your security, privacy and breach controls. They have defined a set of controls. You have to assess organization with respect to that particular protocols. Then in the next step, Health Zone has received a gap report. They have to fix all the gaps and they have to remediate the action as suggested by the assessor. Then in the final step, once everything was remediated, all the gaps were closed as per the HIPAA assessment report, they have gone for the final audit. And after the satisfactory audit of the final HIPAA compliance, they have achieved HIPAA compliance. So how they have gone through each step? First step, they have defined the scope. So because though their application was hosted in a third party, their physical location, their office, and their call center was in a scope, because through call center they were getting PHI, and the areas from where they were accessing their hosted applications, those physical areas were in a scope. Data center and data center will be included in a scope as a subcontractor entity. Then business processes, which all processes were accessing PHI were taken in the scope, and respective business divisions also. Next step, they have identified the assets. So again, your focus has to be on the PHI. So primary asset will be protected health information and the processes that are accessing the PHI. Secondary asset will be infrastructure and servers that are hosting, accessing, or transmitting the PHI. Friends, here I would like to emphasize on one point. We should not confuse between assets and asset container. Asset is the primary thing that we are going to protect, and your servers, your network devices are the containers that are hosting or transmitting your primary asset or information. When we have identified the asset, the next thing that we have to identify is the threat. A threat that can impact security and privacy of your asset. It may be insider, it may be external, it may be a deliberate, or it may be a accidental. So when we say insider threat, it's your employees. When we have calculated the threat, external threat, Health Zone has to consider external hackers, vendors, service providers, because they have one application that is publicly hosted. So hackers will be a considerable threat for their environment. Vulnerabilities, what all weaknesses Health Zone had in their environment. Friends, do not confuse between threats and vulnerabilities. Threat is a entity that can impact the security or the privacy of the PHI environment, while vulnerability is a weakness within the system. So what all weaknesses were there in the Health Zone were considered or mentioned as a vulnerabilities. Some of the vulnerabilities that I have listed down are obsolete information security. They had one information security, but it was written some 3 years back by some third-party consultant, so that may not be a relevant information security that can address the current requirement. Then unevaluated usage of the technologies, like they have not considered the threats or risk associated with the cloud environment, and they are planning to go on the cloud environment to host their publicly facing application. They have never, or they have nowhere talked about the encrypted electronically protected health information. So unencrypted PHI may be a huge vulnerability for them. Then lack of information security practices and processes. Technical flaws in systems like change management, their unpatched system, antivirus is not in place. Physical security not in place. They have nowhere talked about the physical security part. Insecure application. They have nowhere talked about the web application firewall or web application penetration test. So insecure application may be vulnerability for them. Then the next step is that risk profiling. We have to cover the risk profiling. Now we have value of asset, threat, and vulnerability. Since here we have listed down the assets, threat, and vulnerabilities related to Health Zone Inc. Asset valuation can be done on the confidentiality, integrity, and availability value. So if you know that this particular asset is there, you can assign a value based on the confidentiality, integrity, and availability value of that particular asset. Similarly, if you know the threat, you have to calculate the likelihood of occurrence of that particular threat. How frequent that threat is occurring in your environment. Like if you are hosting a data center that is in Dubai or in some area where the rain or flood is very less probable, probably that may not be critical threat for your data center. While if you have a data center in somewhere Mumbai, probably a flood and heavy rain may be a threat for that particular data center. So the threat has to be addressed as per the environment. It cannot be a generic threat, it cannot be a standard data, so that has to be considered specific to the environment, considering your business, nature of business and the geographical locations. In the risk profiling, we'll calculate the risk based on the asset value, likelihood of threat and level of vulnerability. How easily that vulnerability can be exploited. Like if you are using telnet in your environment, probably anyone can see the administrative password and login information and can hack your system. While if it is a SSH1, the vulnerability level is much low, and it will be difficult to hack in your system. So based on the control, you can calculate the vulnerabilities, level of vulnerability. Then you have to calculate the calculated risk against the risk acceptance criteria. Then if you have any existing control in place, you can revise the risk score based on the evaluating existing control or applying new control. So once the risk profiling is done, we have to treat those risks. It's not about knowing the risk. We have to fix those flaws also. So when it comes to risk treatment or risk mitigation plan, we have 4 options. So health zone can pick any of these 4. Either they could have treat the risk, they could have deployed some control, or they can tolerate the controls. They can say that it is within my acceptance criteria and I am going to tolerate this particular risk. They can terminate particular risk. I'll just give you an example of termination of risk is when they are planning to move into cloud, they can say, because the risk is very high in a cloud environment, I'll terminate this particular process. So the risk terminated with the termination of the process. They can transfer the risk. If they feel that this particular hosting in-house developed application is a risk for them, they can outsource this activity or they can buy this application from some secure vendors. So they are transferring this risk. They can take insurance. So in this way, they can transfer the risk. But if you're transferring the risk to some service provider or business associate or subcontractor, you have to calculate the risk if you are taking new vendor service. So again, a risk analysis will take into consideration. You have to remember that if we are taking some action, if we are treating or transferring the risk, we can take the action. We have to define an action tracker, and this action tracker has to be has particular risk, action item, closing date, and final status of the particular risk. If we are going to tolerate and terminate the risk, the approval has to be taken. So if they are planning that the health zone is not going for cloud service provider, they have to take the approval from the senior management. So the complete risk management has been done. Now you have to take some documentation. You have to document particular details so that you can prove at the time of audit that this particular activity has been done diligently. So that will come in the result documentation. This result or the risk assessment risk management document must cover the minimum information, that is your asset threat value combination details and associated risk value, method of calculation of risk, what matrix, what method you have used to calculate this particular risk, risk treatment plan against each risk identified, and whatever actions has been taken to mitigate that risk has to be documented in the risk management or risk assessment report of particular assessed entity, so that you can generate or produce this particular report at the time of audit to prove that this particular activity has been done effectively. So this was the entire journey of the Health Zone Inc. HIPAA compliance. They have saved a lot of amount of money by putting the risk analysis in a right way, right manner, right spirit at the right time. Otherwise, if the proper risk analysis is not done, the companies wasted a lot of money in putting the controls where the actual control is not required, and sometimes because they are putting the controls everywhere, the actual areas where the control is required, those areas are missed. So friends, again, this is the last point that we have. Make it balanced and manageable. When it comes to compliance, people get very confused. They take it as an additional responsibility, but you have to integrate those controls in a process. You have to integrate the controls and process so that you can have a process-centering compliance in place. You should target security and compliance will be the byproduct. You have to deploy required services, products, and required amount of training and awareness to handle the compliance related requirements, so that you can have a balanced situation between your business processes, the business advantages, and the compliance requirements. So thanks, friends. Now I think we can take the question and answers. Whatever points you want to discuss with me, I'm open for that.
Thank you, Swati. And at this moment, as she said, we are open for question and answer. Please feel free to type your questions, or feel free to come out here. So Ajit, do you have some questions on the chat? You can start going over.
Yes, we have a couple of queries here. Swati, the first question we have here is, at what stage do we perform a risk assessment once we analyze the controls in place and identify gaps in security rule requirements? Typically, at what stage we perform a risk assessment? Yeah.
Friends, I'll suggest that risk assessment has to be the first step of HIPAA compliance, because in HIPAA compliance, if you know that this particular environment, this particular scope, we have these many risks, probably it is possible to address the controls at the right time. Because doing the risk analysis, once you have invested a sufficient amount of efforts and money in particular control designing, and then you realize that, okay, we have lesser risk in this particular zone and the higher risk in other areas, probably the risk analysis result cannot be translated in an action format or in a format where you can decide the investment and the efforts that are required at that particular point. So it has to be done at the very initial step of any compliance.
Thanks, Swati. And the next question is, who should do a risk assessment?
Friends, definitely we need experts who understand the methodology and who has experience to perform the risk assessment in particular environment. So, but here I would like to emphasize on particular point that risk assessment cannot be performed in some remote location. So even if you are hiring some risk expert who is doing risk assessment for you, they have to take the input from your side, because you understand the particular environment in the best way. So you can hire someone as a consultant or as a third party to perform the risk management. But if someone is saying that I will perform the risk management without taking the input from the organization side, probably they are giving you some illusions. It's not possible to calculate the risk without taking the input from the entity side.
Okay, thanks, Swati. And the next question is how HIPAA risk management process is different from ISO risk management requirement. Can organization have a single risk management process to comply with various other standards as well?
So I'll answer this particular question in this way. Risk assessment method can be adopted from the ISO 27005. But again, as I discussed in my slide, we should not blur the focus. We have to target the focus. In HIPAA, we talk about the PHI. So if your ISO risk assessment has considered your protected health information as a critical asset, this particular risk assessment report can suffice for HIPAA compliance also. But if the ISO risk assessment has covered only process-centric risk and not focused on the PHI or the critical sensitive information, probably you have to revise that particular risk to cover particular asset and related risk. Method can be same.
Right, thanks, Swati. The next question, is there any quantitative policy for threat calculation?
Okay, so since you can calculate the occurrence of threat, I mean, I know that it's a probability calculation. We cannot eliminate that if particular threat has never occurred, it will never occur. So, though it's a probability occurrence calculation, but yes, you can calculate likelihood of threat in particular environment based on the last incidents, but it doesn't eliminate that particular threat will never occur.
Right. So the next question now. Okay. We have recently done risk assessment for the enterprise. Can I use that risk assessment for HIPAA compliance?
Same answer I'll give it to as I mean we were discussing about the ISO risk assessment. If your enterprise risk assessment has focused to protect the health information, protected health information, this is sufficient. Method can be similar, but if your enterprise risk assessment has not targeted, focused, or included the PHI, I think you need to revise it again.
One other question, how long risk assessment generally take?
Okay, so it's actually a vague question, I'll say, because risk assessment doesn't, I mean, we cannot give you a calculated value. Reason is that if you are an entity where you have 1,000 servers, 50 locations, probably it may take for you 6 months, but if you are an entity where you have 10 servers and 1 physical location, probably 2 weeks to 1 month is a sufficient time to calculate the risk in your environment. So it varies on the scope and criticality of the processes that you have.
Right. So one other question, which is the best risk assessment methodology applicable or recommended? A couple of things, Octave, NIST or ISO.
From the HIPAA, from the HIPAA compliance perspective, HHS and OCR recommends NIST 830 for risk assessment framework. So, though they accept other risk assessment methods also, but the recommended one is NIST 830 that they suggest that the entity should go for risk assessment methods.
Right. So another question, I'll just keep that question short. Can a project folk do the risk assessment instead of an information security expert?
Pardon?
Yeah, the question is, can someone from the project do the risk assessment instead of an information security expert?
Friends, a project management can understand business risk very well, but he may not be the right person to address the technological or information security related risks. So I'll say that we need combination a team where we have people from the project side and technology side both. So project people can tell you about the business related risk, while you need IT experts or information security experts. Those can explain or those understand the information security related risk. So we need both.
Right. Again, we have a query on ISO and HIPAA. Could you just add PHI risk to an ISO risk assessment to make it sufficient as a HIPAA risk assessment?
Definitely we can do that.
And there are a couple of queries which I'm skipping due to, we won't be able to take it over the call. We can have it needs a detailed description for that. So those questions I can take it over email.
Sure.
So Ajit, can you start a poll at this point, please?
Sure, we'll do that. Yeah, there are a couple of other queries as well which needs the detailed description, as I said. So I believe the rest of the questions are over. Yeah, we have a short poll as well. We would really appreciate if you could give us your feedback so that we can, give a more value add for our upcoming webinar sessions. It will barely take a minute for your time. Thank you.
Friends, we are available on LinkedIn, on mail. So whatever queries you have related to HIPAA, risk assessment, or any other information security aspects that we can address, we'll more than happy to do so. So we are very much accessible. I mean, whatever queries we could not answer at this point of time because of the shortage of time, we can address those queries over email, and you can reach us whenever you want. Thanks a lot.
So, Swati, thank you. At this time, I would like to take a moment. So thanks for all taking your time out of the busy schedule. And if you're interested in the presentation, please feel free to reach any one of us, and we will send you a copy of presentation if you're interested in that. And I also want to say at this time, if you have particular topic in your mind and you want us to take that topic as a webinar, we are very much open for that, and we will definitely welcome your feedback, and we will announce, as we hear from people what exactly they want to, kind of hear from us. We will come up with those webinars, and we will be here again, So at this time, I want to say thank you, and please give us your feedback, and thanks again, and have a great day or great night, whatever. Thanks. Thank you all, and we are done with the poll at this time, and we got the feedback, and we really appreciate for the feedback. Thank you all, and we're going to close the webinar at this moment. Thanks. Thanks again.